Good afternoon, Scurry County. It's 2 o'clock on Friday, May 8th, and I'm going to give you your 3 times a week briefing. I've got Bianca Gonzalez, and she's the department head at the Scurry County Welfare Office. We're going to talk about what they've got for those that need help. But first, let me give you the numbers. In Texas, total tests is 477,118. In Texas hospitals, there's 1,734. Total cases reported is 36,609, 1,004 fatalities. There's been 197 patients have recovered. And, I missed on the numbers. It's 219 counties have reported cases of COVID in Texas. In Scurry County, we've had 258 tested, 14 are pending, 242 are negative, and we've had the 2 positives, and we're always going to have to show the positives, but those are inactive cases at this point. You probably know that the governor said that the barbershops and salons have opened. I took advantage of that today. Thank you, Jerry. I really appreciate that. I needed it bad. So with that, Bianca, let's kind of talk about what's going on, what y'all do at Scurry County Welfare first, and then we'll talk about what y'all are doing for people.
Yes, sir. Well, we have several central services we do provide to the public. Our most forefront service we provide is our prescription assistance services. We do emergency county issued vouchers, and these vouchers will help the client until 1, they're either to pay for their medications on their own, or 2, a generic prescription mail order service can be established, or 3, a prescription assistance enrollment from the manufacturer can be secured. For expensive medications that most of us cannot afford out of pocket, we can provide assistance through the help of prescription assistance programs. Most programs will provide certain guidelines to enroll, such as obtaining financial proof documentation as well as proof of residency.
Okay.
So prescribed medications, of course, are prescribed by our local physicians here in town, or sometimes C-City. We get some doctors from C-City. And those drugs range from drugs to clear an ear or sinus infection to those, to treat or manage debilitating, potentially life-threatening conditions such as asthma, diabetes, and high blood pressure. So access to these medicines can mean improved patient outcomes and quality of life, and can help prevent or delay more costly medical problems down the road. Yet the number of Americans who cannot afford, to pay for these prescriptions is on the rise, and this poses a serious threat to the individual as well as public health, because it's just they need the medication, but they're out of pocket and they can't afford it. I mean,
absolutely,
especially the way prescription medications are at the rate they are now, it is expensive. But since 2001, when our previous welfare director, Luann Grice, she started our software program that we use to manage, and we manage our clients, our physicians, and our prescription medication orders on this software. So far, we were able to help over 1,000 clients who've been requesting patient assistant programs.
Wow.
We have placed over 9,000 medication orders. So based on the average price of medications in this area, that's over $4.5 million we have saved Scurry County citizens.
That's incredible.
It's been great. These manufacturers been working hard during this time. They understand that people are out of jobs and they're willing to help. We just need some documentation and we can get you going if you're in that situation. But we also partner with the Scurry County Minister Alliance, and we help with utility bills such as TXU Energy. So if you have a TXU Energy bill, we can help you 1 time a year for that. As well, the county issues $20 gasoline vouchers. Say if you have an out-of-town doctor's appointment or treatment, that you can't afford to go out of town, we can help you with that. We will just need proper documentation, such as your license, vehicle insurance, and your appointment card. But those are a few of the services we do provide. I feel like we have been very blessed in this community to have individuals and organizations come forward and offer and render their services to those who have been impacted.
Sure.
It's been amazing, and I'm glad we live in such a tight-knit community that actually care about our people.
Yeah. So before we got started, you and I were talking about that high cost of medications. You said some are $5,000 a month.
Yes, sir. Like Humira,
Mhm.
it treats arthritis, and for 2 pens, it would cost about 5,000 a month.
Wow.
But it just depending on the dosage, of course, it can
Yeah.
extend longer than a month. But just ridiculous.
Yeah.
2 pens, no one can afford
Oh, no.
$5,000 out of pocket without insurance. So
Mhm.
these companies are willing to help these people out, because they understand they've lost insurance, and
Yeah.
we're in a tight spot in our society and economy, but we're going to rebuild, that's for sure.
Absolutely. And I want to thank the person who made the comment about Bianca and her crew down there, because you made me realize that we do need to talk about that, about what you provide down there for people. I don't know who it was that made the comment, but they talked about how great a job y'all are doing down there.
Thank you.
I think they have a family member that's out of work, and you helped them get diabetic medication, I think is what it was. So,
Yes, sir.
So what will you not do down there? What medications will y'all not help that people
Well, you
get?
did pretty good clearing that up the
Mhm.
day before. When was it? Monday when you
Okay.
did your or Wednesday when you did your last
Yeah.
briefing. We do not do pain medications, antidepressants, or anxiety medications. Just for that reason, we try to do most general antibiotics, and if we have to, things that can help your high blood pressure, but we won't do pain, we won't do
Right.
depressants or anxiety medications.
Right. But
But
diabetes medicines, the high blood pressure,
inhalers, we
inhalers.
do inhalers, and we do some anti-blood clotting medications to help prevent strokes. That's pretty expensive, and we can help out with that.
Yeah.
And usually the most expensive medications, we will get them through the pharmaceutical companies just because they're too expensive
Mhm.
for our budget. So it's easier to get it through them because
Sure.
they provide it. So that's pretty much what we do. Mostly diabetic insulins. They are so
Right.
expensive, and we have a numerous amount of people who have diabetes in this community.
Absolutely. Yeah. So let's talk a little bit more about the assistance that y'all do, bill assistance. You said, tell me who it was,
Well,
TXU?
Yes, we actually partner with the Scurry County Minister Alliance, and they grant us through the TXU Energy Aid, and we can help you one time a year. In conditions like this, they will allow us to help you twice a year. We would just need to have to see your proof of income and things like that,
Right.
your ID, your social.
Right.
But we do TXU Energy.
It's just TXU at this point that
Yes.
y'all are able to.
But the Scurry County Minister Alliance, they also do other utilities like the water bill, your gas bill. If you don't have TXU Energy, they can do your other electric company bills, but you have to go through Jessica at Snyder Community Resource Center.
Okay.
She will screen them, and then once they are screened, they'll come back to me and I can help them out.
Okay. Very good.
Up to $100. So.
Okay. So if someone needs some help, they go to 1326th Street.
Yes,
is where
sir.
they need to go.
Suite 201.
Suite 201.
Yes, sir.
When you walk in the door, it's right there to your right. You walk in the door, don't go to that big plate window. They'll tell you right there, it's across the hall.
Yes.
So, Bianca, you're doing a great job down there. We appreciate everything you're doing
I
for us.
appreciate it.
Is there anything else that you wanted to cover?
Say if we can't help you directly at our office, we can make referrals to meet your needs. We will make those referrals to, like I said, the Snyder Community Resource Center. They do help out with utilities, as well as West Texas Opportunities for emergency services. If you need food essential items, the Scurry County Food Cupboard can help with that. As well as our MASH program, which is located at the Cogdell Memorial Hospital. It covers mostly medical necessary in-house services for basic health care services for eligible county residents. So if we can't help you directly, we will find someone who can help you.
And it's a great network. Everybody's
We
networked
work
together
Yes, sir.
really well. And have you seen that get tighter?
Yes.
That network get tighter and better?
Yes, I talk to Jessica at least once a week, and we just stay in communication, and we just help each other out because we're about the same boats of helping our people.
Helping a lot of the same people, aren't you? Doing
Yes,
with
sir.
different aspects.
Yes,
So,
sir.
Okay. Like I said, if you need some help, go to 1326th Street, see Bianca. She'll take good care of you. Thank you, and y'all have a great day. Have a great weekend.